which is located at 11811 Shaker Boulevard, which is Suite 416, Cleveland, Ohio 44120. And I just want to know, what all do you deal with?
Well, first of all, my name is Dr. Catherine Gregg, and as you heard, I'm the director of New Perspective Counseling Center, and I specialize in relationship issues, depression, and anxiety. And one of the things that I try to do is try to change the way people look at things, because the way you look at, when you change the way you look at things, the things you look at changes. So a lot of times when people come in with relationship problems, it's all about how they're looking at things. The wife might have a different perspective about what's going on than the husband, and I have to put them both on the same page and help them to understand where each one of them are coming from. So that's one of the things I specialize in, changing the way people look at things.
And what do you find it easy to deal with things in the community? I will even say for myself, I'll go back to my past and I'll say that 1985, I don't like to look at certain things, but my daughter, she passed at the age of 11 months. Instead of dealing with everything, I was at that time taught from peers and other people, self-medicate in large droves. That meant alcohol and other things. You don't deal with things or talk to people or what have you. The reason I'm bringing that subject up is for those who may be going through anything right now, the importance of being able to at least go and get that necessary, I'll say, traumatic care, in your opinion.
Yes, I think a lot of people, well, first of all, in the society that we live in, you will find that most people self-medicate. And sometimes it's better to self-medicate on certain things than others. A lot of people self-medicate on heroin, and it's very addictive, and it takes a while to come off if they ever come off. I remember when I was working at the Cleveland Drug Center downtown, I had people coming in. They were 80 years old, 70 years old. They've been on drugs all their lives, and they come in and get methadone. They get a week's supply of methadone. If they go out of town, they have to take methadone with them. They cannot go out of town without their medication.
Wow.
Now, of course, there are some things that I think are much better than others. Marijuana may be a little better than being addicted to heroin. But I'm not saying that people should use it. I'm just saying they're trying to legalize it now. So I know I get a lot of clients who come to me and they tell me they don't understand why it's not legalized, because they'd rather smoke some marijuana than take these pills that are addictive. So in a society that, like the one we live in, all kinds of stresses, money-hungry society, we have a lot of people who are self-medicating on various things because the society perpetuates that kind of thing.
Thank you.
Now, your mission statement says your services assist in helping individuals find ways to better cope with personal problems and adverse social conditions. Mm-hmm. Now, to me, that stands out because I get a sense of that you are basically preparing people that life will be, quote unquote, unfair. Life will throw all of these things at you, and you just have to be prepared to deal with them. Is that basically the mentality of the
One of the
program?
things I do is I try to change the way they look at it. Because oftentimes, see, your thinking controls how you feel, it controls how you act. Okay, you're not gonna, you very seldom see a person thinking happy thoughts and depressed. So since they have to deal with the things in the society, I try to help them to adjust to it without being stressed out. So you have to change their way of thinking so they can do that. Sometimes I get people coming in, I might have a person coming in going through a divorce. And I might have two people coming in going through divorce. And one of the person may be thinking about committing suicide, maybe thinking she's a failure, whereas the other person may be thinking, oh, this is an opportunity for me to meet somebody else. As a result of that type of thinking, their actions and behavior is going to be different. Mm-hmm. One of them might commit suicide, and the other one would be very happy going along trying to find someone else, what she should be doing.
Now, how long have you been practicing?
Oh, I've been practicing over 30-some years, but I've been in private practice for about 15 years.
Okay, so with your 30 years of experience, what would you say is the most common thing, like from the first year to the 30th year? What is the common thing that you see that is not changing from generation to generation?
Well, communication. Communication is always a problem, regardless of what generation you're in. Right now, we have 5 different generations working in the workplace simultaneously. We have the traditional generations. That's what my mother generation. We have the baby boomer generation, and we have the millennials, and my sons, and we have the X generation, which is the grandkids. They all working together in the workplace now, and the biggest problem they're having is communication, because they're from different generations. They have a different outlook on life, so they think differently about a lot of the things.
So how would a millennial communicate versus a baby boomer?
Millennial would like to communicate with text messages. Baby boomers like to communicate directly through emails and things like that, because that was the case when they were coming up. People were communicating with email. Now, this last generation coming in, I say the millennials, when they came in, we were technology bound. So they was born into a generation full of technology. They don't even know what a rotary telephone looked like, a pager looked like.
Right.
So naturally, their thinking is a little different than those who were born during the baby boomer generation, right? Okay.
216-578-1490, the most interactive radio talk show host in the whole wide world. Dr. Catherine, we're getting calls already. Who's on the line? Talk to me. Yes, who's on the line? Talk to me.
People also self-medicate through food, like chocolate, things such as that. Isn't that right?
Yeah, that's true. Yeah. Eating, we have quite a few eating disorders. I don't treat eating disorder, but I think that if I can change their way of thinking, I can address that too. Because the people... I'm sorry, go ahead.
I have a bad relationship problem as a caller with these hosts on this show, but we could deal with that at another time because I have another question. Do you deal with people who are in marriage? Do you deal with the positive end of relationship problems? Like somebody might have, they might be preparing to be married, or preparing to deal with the woes of of starting a family together, and they just want somebody, as the couple wants to sit down with you and talk about, look, we having some problems sorting some things out that we know we're going to push forward on, but it's not necessarily a negative thing. They're just having problems sorting it out. Do you help people with things like that?
All the time, because a lot of times couples go to marital counseling before they even get married.
Right. Do you talk with people like that?
Oh, yeah, I do. Yes, I do. And because one thing you have to keep in mind, there's always a positive and negative side to everything.
Yeah,
so
all dilemmas aren't necessarily bad. All dilemmas are something to be solved, but all dilemmas aren't necessarily a bad thing. Could you elaborate on how you help people in marriage counseling, or married couples that have decided they wanted to start on a family and they're having some problems working out? Could you elaborate on talking about that? And I'll listen off the air.
Okay, well, I see couples like that every day. And a lot of times you think that couples have it together, and they really don't until you start talking with them. Then you find out that they're totally on different pages. One of the things I suggest that couples do is put the relationship first. Not their individual differences or similarity, but work towards building the marriage. And that could mean a whole lot of things. That could mean compromising, which you have to do when you come together with someone. You can't continue doing the things you've been doing all along, and she can't continue doing the things that she's been doing. You all need to sit down and talk and find out what your likes and dislikes are. Find out what your values and beliefs are. I have a couple right now that I'm seeing, and they've been married for 1 year. And when they got married, they did not discuss religion. Now, that's the biggest problem they have now, because the husband wants the wife to join his church, and she doesn't like his church. They both Baptists. One is a Protestant, and one is she's looking for a church, and she feels that they should start a new church. Start off at a new church somewhere instead of going to the old church. He says he's not changing. He's been there 30 years, and he's not going anywhere. So they coming to me for Christian counseling. So I asked them, what does the Bible says about it? And they didn't know. I said, why are you coming to me for Christian counseling? You don't even know what the Bible say about it. So I had to print out the scriptures about what the Bible says about marriage, so they can see if they're working towards the marriage the way they say they believe in. They say that they're Baptist, so they should be working towards their marriage according to biblical scriptures, and that's what I deal with. If they're Muslim, I deal with that with the Quran. If they're Buddhist, I use their book, the Bhagavad Gita. So Communication, as I said, is the most important thing. Helping them to understand each other and where they're coming from.
I'm going to let you come in. 216-578-1490. 216-578-1490. The number one show on Sunday night, the Art McCoy University Radio Show. Call in now if you have a question. 216-578-1490.
I have the perfect question for you.
Okay. I'll see if I can give you a perfect answer.
Okay. And I want the woman's perspective, but I want the 30 years of counseling expertise perspective mostly. Is honesty the best policy in relationships?
I like to think so. Really, I would.
Okay.
And I do think it's the best policy if you have a person who can deal with honesty. A lot of people can't deal with the truth. So sometimes it's not the best policy to be honest. Because they'll tell you they can accept these things, but they really can't. When you tell them these things, they keep it in the back of their minds until something comes up and they throw it at you. Mm-hmm. That's what I noticed that couples do. But for me, honesty is the best policy. I try to be honest at all times, and people tell me I'm too honest at times. But I tell them that should I lie because people can't deal with honesty? So I have to be who I am. And I think that what's important is that we learn if we're going to be with someone, we should learn how to accept them unconditionally. A lot of times people get into relationships and they see something they know they don't like, but they don't say anything about it to the husband or to the wife. They just think, well, maybe I'll change that about him later on. And that creates a lot of problem because you can't change anyone.
Okay.
So the best thing to do is find somebody who already have the qualities that you have and go with that.
I got another question for you. It seems like mental illness has kind of been frowned upon within the black community. And we're kind of prideful about admitting our faults and our shortcomings and different things like that. Why do you think that is, and what can we do to address that?
That is true. But I'm getting more blacks coming to counseling now. A lot of them are mandated for one thing. But as a whole, I think our race do not trust the larger population, the white population. We don't feel that we can share things while it being held against us, or we end up getting in trouble because we do these things. And some families believe that things should be kept within the family. The older generations do. You shouldn't share your business with everyone. You should keep it within the family, and that's been a big problem throughout history. And a lot of times we have a lot of things happening to our kids, to our wives, and they keep it to themselves when they should have sought help. So it's good to seek help. It's good to seek help from someone who don't even know your friends, because that way you can feel safe that your information will not be shared with anyone else, because we have to keep things confidential.
216-578-1490. Who's on the line?
I'm on the line, Mr. McCoy.
Yes, ma'am. How you doing?
But she just answered it, that I see that senior citizens and all need to seek help also if they need it.
Oh, yeah,
She just answered the question.
Yes, that's true. I work with senior citizens all the time, and most of my friends are senior citizens. You can learn a lot from senior citizens.
All right. Thank you for your phone call. We appreciate you.
Thank you. Bye-bye.
Yes, ma'am. Thank you so much.
Another question.
Mm-hmm.
Violence is very prevalent in Cleveland, as we know. Do people ever really recover from these situations, from the loss of a loved one through violence? How difficult is that to really overcome and to really open up to a counselor and talk about those things, and talk about you losing a son, before they reach 25, 20 years old, and different things like that? How difficult is that?
Well, some people find it easy to talk about, some don't. I've had parents coming to me whose sons have been shot or killed or whatever. My son was shot too at one time, and I thought he was going to die, so I could share that with them when they come to see me. So I understand how they feel. And it's not easy, and there's no certain time period when a person should get over grieving. You know, grieving is something I talk about all the time with my clients when they come in. In fact, sometimes I go to various corporations and talk about grieving to them when someone dies, or when, like last week, one of the employees shot himself, killed himself. He was 55 years old, and I had to go out to a large company to talk with the staff about that, to help them to deal with their griefs, to walk them through the grief process. And those are things I do quite often. And it depends on the individual. Some people are private people, and they like to keep things to themselves. It's difficult for them to share. And some people tell you too much at times. You know, you can meet someone at a bus stop, and they'll start talking with you
Yeah.
like they've been knowing you for years.
Yeah.
All right. Thank you. 216-578-1490. Who's on the line?
Hello, this is Vivian L. Sharp, and I just want to commend you on the program you have with my friend, Dr. Greg. People don't know it, but in 1991, when I arrived in Cleveland, I had a nervous breakdown with a marriage that I had married a preacher, and he had a problem with his sexuality. But Dr. Greg and I have spoke about it, and she has been on our program, and I just want to tell the people that she's honest and she's a great person. That's all I want to say.
All right. Thank you so much
Thank
for
you, Vivian.
All right. Thank you so much
Thank you.
for your phone call.
216-804-7462. And one of the comments that just came about is a lot of times we do face too much trauma from the inner city violence, from vigils. What would you like to see done when it comes to counseling more people from the inner cities, and can you do families?
Yes, I do families, and I think that one of the things that we need to do is train the parents, educate the parents, because the parents are with these kids more than anyone else. Oftentimes, when I've done social work, counseling in the schools, and in the evenings I would meet with kids at the library, and their parents would send them to the library when they get out of school because they didn't want to be bothered with them, and they would stay at the library until the library closed. And parents do not spend enough time with their kids. They're too busy doing what they do. So once the parents become more educated and began to realize the impact that they have on their children, I think they would change. I think if they knew better, they would do better. And I think that a lot of our younger parents don't know any better because they have these kids I was a teenage mom too. I had my first child when I was 15. So I see this all the time, and I try to work with teenage mom because I was there. So, and a lot of times people think that teenage moms are supposed to grow up just because they have a child. But you still have to go through those same developmental stages that adolescents go through. You can't just grow up become an adult because you have a child. So I try to work with them on that.
New Perspective Counseling Center, LLC. Our phone lines are lit up. One line open. Who's on the line?
Hi, this is Tad. I have a question, please.
Yes, ma'am. Go ahead. Talk to the doctor.
What I need to find out is that the man that I'm with for about 20 years. Now only reason I got with him because of the Bible. You know, I know the Bible through and through, and it says don't be unequally yoked. Mm-hmm. And I find out that he really don't want to get married. He was it's a long story. He's got a record and stuff like that, and I didn't know that, and I thought maybe I could change him, you know, to be what I wanted him to be, you know, what he should have been. You know what I'm saying?
Well, it's not up to. I don't think it's up to us to say what a person should have been. You know.
I know that, but what the Bible says, don't be unequally yoked, right?
Yeah, the Bible does say that, but it could be interpreted in various ways.
Yeah, well, that's true. I guess I must interpret it wrong.
How are you interpreting it?
I interpreted, you know, you have to be of the same faith and stuff like that. And,
yeah.
You know, he was a Church of Christ, and I am too, you know, and I thought maybe, you know, and I saw that his clothes was dirty and stuff like that, you know, and I said, maybe he just didn't change him or something like that. You got to make it all kind of excuses. You know what I'm saying?
Did you say you both are a member of the same church?
Uh-huh.
Well, one of the things I noticed, just because a person go to church doesn't mean too much.
Yeah,
What you need to look at is whether or not they're applying the principles that they're learning in church to their lives. Are they living it?
Yeah, that's
Same
true.
way with Alcoholic Anonymous. I get people coming to me from AA all the time. Well, AA doesn't help me.
Mm-hmm.
But when I ask them, have you applied the 8th step to your life? Have
Uh-huh.
you made amends to the people that you hurt? Oh, no, I haven't done that yet.
Uh-huh.
So if you don't apply these things that you're learning, you're not going to grow.
Well,
You're
this
not
is
gonna-
so true. This is so true.
So that's what I noticed. So that's because you go to church doesn't mean anything. You don't have to go to church to be spiritual.
Well, that's true too. But the Bible also says don't forsake yourself to be assembly with other Christians. Doesn't it say that?
So
Whatever other Christian means to you.
So here's what I'd like to do at this point here. Listen, New Perspective Counseling Center, LLC. Listen, don't be like me. I should have known the doctor a long time ago. So
Right.
doctor, give out your information, how this young lady can reach you if she needs your counseling service, and so possibly you can help her.
Okay, my telephone number is area code 216
Go ahead.
791
791. Go ahead.
0910.
0910.
Yes. Again, that's 216.
7910910. Right.
Yeah, give me a call.
And what's your name again?
Dr. Catherine Gregg, Greig.
Okay, Dr. Catherine. I will call you because this is a long story anyway. So I guess you guys got to go, right?
Yeah, yes, ma'am. Yes, ma'am.
Okay, then thank you so much, Art McCoy. I listen to you just about every Sunday.
All right. Thank you so much for listening. All right.
Okay, bye-bye.
All right. Dr. Gray, we got so much to talk about and such little time to do it. I should have brought you on for the whole hour. But Dr. Gregg will be a part of the program, so she'll come back often. But there's a lot I got to talk to you about. Listen, your specialty, ADHD. Talk to us about it.
Well, attention deficit disorder, that's what that means. Attention deficit hyperactive disorder. And oftentimes when kids are small, they tend to lose things, they tend to forget things, they have problems focusing. And a lot of times parents put them on medication too soon for that, I think. Because that's what you want a child who's active. You want a child who's doing things. And a lot of times parents don't want to deal with their kids, so they take them to the doctor, and the first thing the doctors do is prescribe medication, Adderall or some other medication for them to help them to focus. Now, some kids do tell me that it helps them to focus better. These are the ones, the teenagers. But I'm seeing kids on it at 5, 6, 7, 8, 9, 10, and I don't think they should be on it.
Doctor, we got a lot to talk about in this area because there was pressure in my son also. Moving right along, couple counseling.
Yes.
Talk to me. We do some fast talking. Couple counseling. You do that?
Yes, all the time. That's my favorite, really, couple counseling. And one of the things I do is when clients come in or couples come in with problems, to me it's very simple. Somebody's needs are not being met.
Lord have mercy.
That's all it is.
Yes.
So I ask the wife to make a list of her needs, the things that she's not getting from her husband, and I have the husband make a list of the needs that he has, the things that he's not getting
Whose
from his
list is
wife.
usually longer?
And it varies.
Okay.
And I give the husband the wife's list and give the wife the husband list. And I said, the next time you come here, I want something done on this list.
Lord have mercy. You got a question? Because we got 5 minutes. I want to get a lot of questions.
Children, you were saying like 4, 5, 6 years old. They're active anyway, aren't
They
they?
are active anyway.
I mean, that's natural because we were active when we were coming up.
And sometimes when they're placed on this medication, it's really stunt their growth.
Yeah.
And you can see it later on in their behavior. They become very aggressive. And sometimes the medication makes them very aggressive.
Doctor, we got to talk about this for a long time. Anger management. Lord have mercy.
Yeah, we all have anger management problems at times. We all do. But when it gets to the point where it's creating problems for you on your job, creating problems with your family, and creating all kinds of problems that interferes with your daily functioning, then you have a problem. You need to come and talk with someone. Oftentimes, anger, where you see a lot of anger, there's a lot of pain. We have so many people walking around here with so much pain, pain that has not been addressed throughout their lives. So it comes out as anger. I have one client who he came in not too long ago, and he has a lot of anger in him. He says he decided he needed some help with his anger. After talking with him, he don't talk with his dad. He can't stand his mother. He don't talk with his aunt. So there's some pain there somewhere. And I told him, until you make amends with your family, the pain is not going to go away, and the anger is not going to go away. So now he's talking with his mom. He came in this week, he's talking with his mom. He was very happy when he came in this week. And he says, I don't know why I'm so happy. I said, because you spent some time with your mom. Now you have to spend some time with your dad. Well, I hate him. I don't know when that's gonna happen.
Hey, doctor, you're good. A real bad problem. I know they need to come to your office. Substance abuse, quickly.
Yes, I get substance abuse people all the time too. In fact, I'm a therapist for the Department of Transportation. Anytime someone working for the Department of Transportation, they're driving a truck or whatever, and they have a dirty urine, they have to come to me. And we have a little counseling session, and then I evaluate them and give them permission to go back to work. And they're self-medicating, they're doing all kinds of things. And some just smoke marijuana for recreational purposes, to relax them instead of taking Valiums and other things.
Grief counseling, quickly. You do all this, don't
yes,
you?
Yes, I in fact, I go to organizations, I said earlier, when a staff member dies.
30 years you've been doing this, right?
Yes.
All right, go ahead.
So when a staff person died or an employee died at some organization, they send for me and I come and work with the staff to help work them through the grief that they're experiencing over the death of someone. And I have people come into my office and I do the same thing.
Dr. Gregg, I should have brought you on. When you come back again, I'll give you much longer. We have 3 minutes. I want you to give your closing argument on when they should come to your office, how you would treat them, and invite them on in, because we got a lot of people listening that needs your service. 30 years in the business.
Anytime you have a concern or issue that you feel you're not seeing clearly, that's the time you should come in. I remember when I was attending Case Western Reserve University working on my master's degree, our professor came in late. And she said, I'm sorry I'm late, but I just left my shrink. She said, if you don't have one, I suggest you all get one because you all need someone to talk to. She later became the dean of the university there, black female. So I never forgot that. And I felt really empowered, and I felt good when she said that. Because if she could say it, and she's a professor there, that was really good. It helped me. So I have somebody I talk to. I have a couple people I talk to. Okay?
Are they professors?
Yeah, they in my field.
Oh, okay.
Yeah, we have the same problems everybody else have. We're no different.
I forgot it.
That's okay. Just speak right to the microphone. Yes. Go ahead. You got something else to ask?
No, that's it. I was just wondering,
All right, so I want you to tell them, dear, we got a minute and a half. I want you to tell them how they can get in touch with you and all that.
Yeah, my telephone number is area code 216-791-0910. I'm located at 11811 Shaker Boulevard, Cleveland, 44120. Not too far from the rapid station up there on 116. You can walk to my office from there, or you can walk to my office from Shaker Square. So please give me a call. I look forward to hearing from you.
One quick question. Is there a way to have a new perspective before the grief happens? I know you can't prepare for the unexpected, but what would you recommend?
Well, a person has to teach you how to have a new perspective. Sometimes life itself causes you to have a new perspective. You know, sometimes you're confronted with challenges in life that cause you to change. People don't change when they're feeling good or when they're feeling happy. They change when they meet challenges in their life, when they suffer. That's when they start looking to a higher source. That's when they start looking to what they call God or whoever they look to.
All right, Dr. Gregg, we'll definitely bring you back. You had a lot of more calls we couldn't get to. We'll bring it back again, okay? We love you. Thank you very much. Bye-bye.